IV insertion, the first thing I'm gonna do is identify my patient and identify the physician's orders. As I walk in the room, I'm gonna wash my hands and I'm gonna put on clean gloves. So once I have the clean gloves on, I'm gonna pick the arm that I'm gonna be doing my IV on. And in this situation, I'm going to be doing the right arm. So I'm going to put on my tourniquet. And I pick the vein that I want to use, working distal to proximal. And I'm going to pick this vein right here because it's straight and there's no bifurcation to other veins. So I got my site picked. I'm going to also be doing a blood draw. So I'm going to go ahead and get my blood syringe and hook it up to my piggy tail. Have that ready to go. I'm going to core prep the site that I picked for 30 seconds. So once that's clean, we're going to insert the needle. So we're going to make sure the bevel's up. We're going to hold the skin taut with our non-dominant hand, and we're going to insert at a 45-degree angle. We're going to tell the patient that we're about to insert. So 1, 2, 3, and insert at a 45-degree angle, and then level out. And then as soon as we get flashback, we're going to stop, and we're going to remove the needle from inside the catheter, and remove the needle completely. We're going to discard this in the sharps. We're going to occlude, and we're going to get that piggy tail that we have ready and attach it to the hub. And we're going to draw blood. Once we got the blood, we're going to sit over here, ready for later. And then we're going to get our normal saline, and we're going to saline lock this. We're going to get another normal saline that I do not have ready, so we're going to say that this is another one since I dropped it. We're going to get another one new, take off the cap, insert, and we're going to flush the tubing, making sure that before we flush the tubing, we're going to take off the tourniquet, and then we're going to flush, making sure that the IV is patent. And once we've done that, we can clamp the tubing, take off the syringe, and put it back like that. And then we're going to want to put a hubcap on the end of this piggy tail to keep sterility. And then I'll get my tegaderm and place it over just like that. Make sure to get the back off. And then we're going to get a piece of tape and secure the piggy tail. Now that's secure, we're going to get our other little sticky that has our date and time and all the information on it, and we're going to initial, date, time, the gauge and needle we use, which is a 20 gauge, and my initials, and have that on it there. And then we're going to take the blood syringe that we've drawn blood with, and we're going to insert a needle cap to it. And we're going to have our blood vial ready to go. We're going to uncap the needle and insert the blood in there. Okay, and we're going to discard this in the sharps. And then we're going to label this, and we're going to send it down to the lab. And I'm going to take off my gloves. I'm going to wash my hands, and I'm going to clean up everything, and I'm going to document. I'm going to document how the patient tolerated the procedure, the time, the date, when it happened, and if there was the assessment of the insertion site, if there's any redness or swelling and any of that after the insertion, if there was any reactions, I would document what was given to the patient, fluids, anything like that, what the doctor had ordered. I would document if it was a continuous IV, a bolus, and that it was saline locked. In this case, it was saline locked. And then my 5 rights of medication administration is right route, right time, right patient, right dose, right medication, and right documentation.